Today we're shining a light on a rare but deadly infection, gastrointestinal mucormycosis. This is a condition that many people have never heard of, yet it poses a significant threat to those who are vulnerable. This fungal disease targets the digestive system, stomach and intestines, and can be devastating. It often starts with symptoms that are easy to overlook, such as abdominal pain and nausea. It's caused by mucormycetes, molds found everywhere in soil, decaying leaves, compost, and even the air. These molds are part of our everyday environment, making them nearly impossible to avoid. For most healthy people, these molds are harmless. Our immune systems are usually strong enough to fend off these invaders without any issues, but in those with weakened immune systems, they can become life-threatening invaders. This includes individuals undergoing chemotherapy, organ transplant recipients, and those with chronic illnesses. When mucormycosis infects the gut, it disrupts digestion, nutrient absorption, and waste elimination. This can lead to severe malnutrition and other complications. The fungus can destroy tissue, leading to bleeding, blockages, and dangerous holes in the digestive tract. These complications often require emergency medical intervention. It can also spread through the bloodstream, making treatment even harder. Once it disseminates, the infection becomes more challenging to control and can affect multiple organs. Today, we'll break down what this infection is, how it develops, who's at risk, and the warning signs to watch for. Understanding these aspects is crucial for early detection and effective treatment. We'll also cover how doctors diagnose and treat it, and why early detection is crucial. Diagnostic tools like imaging and lab tests play a vital role in identifying the infection early. Most importantly, you'll learn practical steps to protect yourself and your loved ones. Simple measures like good hygiene and being aware of the risks can make a big difference. Awareness is key. Let's get started. Knowledge saves lives. By understanding this hidden threat, we can better protect ourselves and those we care about. Mucormycosis is a rare but serious infection caused by molds from the Mucorales family. These molds are a type of fungus that exist all around us, often unnoticed, but can become extremely dangerous under certain conditions. You'll find these molds thriving in places like rotting wood, compost piles, and garden soil, environments rich in decaying organic matter. They're not just limited to the outdoors, they can also be present in indoor dust and on surfaces. These molds reproduce by releasing tiny spores into the air. We can inhale these spores without even realizing it, or sometimes ingest them through contaminated food or water. For most healthy people, this exposure doesn't cause any harm. However, for people with weakened immune systems, such as those with diabetes, cancer, or recovering from organ transplants, these spores can lead to a life-threatening infection. In rare cases, mucormycosis can be deadly, especially if not treated quickly. The term black fungus became widely recognized during the COVID-19 pandemic when a surge in cases was seen among patients recovering from the virus. The nickname comes from the blackened, dead tissue, called necrosis, that the infection causes. Mucormycosis is extremely aggressive. It invades blood vessels, cutting off blood supply and causing rapid tissue death. This process can lead to severe complications, including organ failure and even death if not managed urgently. There are several types of mucormycosis, depending on where the infection takes hold. Rhinocerebral, affecting the sinuses and brain; pulmonary, lungs; cutaneous, skin; disseminated, widespread throughout the body; and gastrointestinal, which targets the digestive tract. Gastrointestinal, or GI, mucormycosis is especially rare, but extremely dangerous. Its symptoms can be vague, making it difficult to diagnose until the infection is advanced, which increases the risk of severe outcomes. The fungus's ability to block blood flow and destroy tissue makes it a formidable threat. It can cause ulcers, perforations, and massive tissue loss in the affected organs. Understanding how mucormycosis works is crucial for both doctors and patients. It helps explain why early detection and aggressive treatment are so important, and why this infection is so challenging to manage. Now let's focus on how this dangerous infection can take hold in the gut, and what makes it so difficult to spot before it's too late. For those at risk, staying alert to the warning signs is critical, because GI mucormycosis is a true medical emergency that requires immediate attention. Next, let's see how this infection actually begins and spreads within the body, setting the stage for the challenges ahead. GI mucormycosis usually starts when someone ingests fungal spores, often through contaminated food, water, or herbal remedies. These spores are microscopic and invisible to the naked eye, making it nearly impossible to know when you've come into contact with them. In some cases, even seemingly clean or fresh foods can harbor these dangerous fungi, especially in environments where sanitation is a challenge or food is stored improperly. In healthy people, stomach acid and immune cells destroy these spores. The body's natural defenses act as a powerful barrier, neutralizing threats before they can cause harm. This is why most people never develop symptoms, even if they ingest a few spores from time to time. But in those with weakened immunity, such as the elderly, people with chronic illnesses, or those undergoing treatments like chemotherapy, spores survive, settle in the intestines, and start to grow. Their immune systems can't mount a strong enough response, allowing the fungus to take hold and multiply rapidly. The fungus invades the gut wall, targeting blood vessels and cutting off blood supply. This process is aggressive and can happen quickly, often before symptoms become obvious. This leads to tissue death, ulcers and lesions, weakening the gut wall. Patients may experience severe abdominal pain, nausea, or vomiting as the infection progresses. Severe complications can follow, massive bleeding or a perforation hole in the stomach or intestines. These emergencies require immediate medical attention and can be life-threatening. If a perforation occurs, gut contents leak into the abdomen, causing life-threatening peritonitis. This condition can rapidly lead to shock and organ failure if not treated right away. The fungus can also spread via the bloodstream to organs like the liver or heart, making the infection even more dangerous. Once it reaches these vital organs, the risk of death increases significantly. This widespread infection or dissemination makes treatment much more difficult. Doctors must act quickly and aggressively to try to save the patient's life. The key takeaway: this infection escalates quickly and can be fatal if not caught early. Early diagnosis and intervention are absolutely critical for survival. Next, let's look at who's most at risk. Recognizing the warning signs and understanding who is vulnerable can help save lives. Understanding risk factors is crucial for prevention. Let's dive in and learn how to protect ourselves and our loved ones from this dangerous infection. Mucormycosis targets those with weakened immune systems. Uncontrolled diabetes, especially diabetic ketoacidosis, creates an ideal environment for the fungus. Blood cancers like leukemia or lymphoma and their treatments leave patients immunocompromised. Organ or stem cell transplant recipients are at high risk due to lifelong immunosuppressant drugs. Other vulnerable groups include people with HIV/AIDS, iron overload, those on long-term corticosteroids. Severe malnutrition and premature infants are also at risk. Importantly, mucormycosis isn't contagious. You can't catch it from someone else. The danger comes from environmental exposure plus a weakened immune system. High-risk individuals must stay vigilant for symptoms. Next, let's talk about what those symptoms look like. Early recognition can save lives. Symptoms are often vague: persistent abdominal pain, swelling, nausea, and vomiting. Vomiting blood or passing blood in stool are serious red flags. Fever, diarrhea, constipation, weight loss, and weakness may develop as the infection progresses. Sudden, severe abdominal pain can signal a perforation and peritonitis, a medical emergency. These symptoms mimic many other conditions, making diagnosis tricky. High-risk patients with unexplained abdominal symptoms should seek immediate medical attention. Don't ignore these warning signs. Early action is critical. Now, let's see how doctors diagnose this elusive infection. Diagnosing GI mucormycosis is challenging due to its non-specific symptoms. Doctors rely on clinical suspicion, especially in high-risk patients with severe abdominal issues. Imaging, like CT scans, can reveal gut wall thickening, inflammation, or perforation. Definitive diagnosis requires a tissue biopsy, often via endoscopy or colonoscopy. The sample is examined under a microscope for the telltale fungal hyphae. Sometimes the fungus is cultured in a lab to identify the species. Early diagnosis is vital. Delays can be deadly. Once diagnosed, treatment must begin immediately. Let's look at how doctors fight this infection. Speed and precision are everything. Here's how treatment works. Treating GI mucormycosis requires urgent, aggressive action. The mainstay is intravenous antifungal drugs, usually amphotericin B. Doctors monitor for side effects, especially on the kidneys, and may use newer, less toxic formulations. Other antifungals like posaconazole or isavuconazole may be used if needed. Surgery is often essential to remove dead, infected tissue, sometimes requiring removal of large sections of the gut. Multiple surgeries may be needed to control the infection. Addressing the underlying condition, like controlling blood sugar or adjusting immunosuppressants, is crucial. This combined approach offers the best chance of survival. Early aggressive treatment saves lives. Next, let's see why timing is everything. Time is the most critical factor in surviving GI mucormycosis. The mortality rate is extremely high, often due to delayed diagnosis. Early detection means less tissue damage, less extensive surgery, and better outcomes. Delays can lead to massive gut resections, lifelong nutritional problems, or fatal septic shock. Both patients and doctors must act fast. Any new, persistent abdominal symptom in a high-risk person is a red flag. Don't wait, seek help immediately. For healthcare providers, always consider mucormycosis in immunocompromised patients with unexplained abdominal issues. Prompt imaging, biopsy, and starting antifungal therapy can be life-saving. Vigilance and speed are your best defense. Now, let's talk prevention. While we can't eliminate these molds from the environment, high-risk individuals can take steps to reduce exposure. Avoid activities that stir up dust or soil. Skip gardening, yard work, and construction sites if possible. If unavoidable, wear an N95 mask for protection. Don't handle compost or decaying organic material. Practice strict food and water safety. Drink only boiled, filtered, or bottled water, and wash all produce thoroughly. Avoid old or spoiled food and store food in clean, sealed containers. Most importantly, manage underlying health conditions, control blood sugar, and work with your doctor to minimize immunosuppressant use. In some cases, preventive antifungal medication may be recommended. With vigilance and smart habits, you can lower your risk of this deadly infection.